of our speakers, and that would be Dr. Ama Shallangwa. Sorry about that. Dr. Ama, please.
Can you all see my screen?
Yes, we can.
Okay. Thank you, Michael, and the executive of DANED for organizing this and inviting me today. I'm going to be speaking about information disorder and how misinformation can influence the uptake of vaccine or vaccine hesitancy. Just a little bit of disclaimer, I am not here today in my official capacity. I am not representing my organization, neither am I representing any vaccine company. I've not been paid to do this. We've not been paid by any vaccine company, and we're not here to promote any vaccine products. We are just here as responsible people from the community who see that there's a need to respond to the misinformation going around regarding COVID. Thank you. So moving on to my first slide. It's not moving. Is it moving? Yeah. Okay. So this is a nice infographic about the different types of information disorder, and it ranks from the falseness of information to its intent to harm. And looking on your left, the first circle there, misinformation. This is when you receive an information and it is clearly false, it is inaccurate, but it is shared as a joke or as a satire or just for fun, and it shouldn't be taken seriously. And this kind of information are not created to cause any harm. They are just for fun, and they're just as mere jokes. But we know that sometimes some of these jokes and satires can be taken out of context. Now, where it begins to become harmful is when it gets into the second circle. In the intersection there, you can see disinformation. This is where information is fabricated, is deliberately manipulated for conspiracy or to increase rumors or for any other reason. And then it gets even worse when it goes to the right, where we see malinformation, and this is deliberate fabrication of information. It is false and it has the intent to harm the population. And for example, it might have an element of truth in it, but it might be that the date, the day, and the time of that information has been changed to suit the present day. So that information is not valid for now. It was valid at that time that that information was created. So this can harm the public because it is deliberately manipulation or change of dates of something to represent what is happening now, which is not the case. And the next slide is also talking about misinformation. And the 7 boxes that we see here will fit into one of those 3 circles that I just spoke about. And I will not talk about all these. I will just talk about the first and the last here, if you can see my pointers. So the first one, which I already mentioned, is when information is clearly not to harm. It's just for joke and maybe as satire, just for people to have fun, but it might be taken out of context. And those kind of information are quite okay because the reason why they were made is not to harm. But then again, this last slide, you can see that there are some information that will have a very nice caption, a big heading that has no link to the content of the story. So nice caption, but disconnect with whatever is written inside. So we need to analyze situations. We need to analyze information when they come to us. And you will agree with me that every morning you wake up and you look at your WhatsApp message, you see different kind of media, stories, text, of different things happening. For example, during this pandemic, you might see some kind of drama happening where they will say someone took a vaccine and this is the thing that is happening to them and they are shaking and all that. We need to be able to judge the kind of information that we receive, whether they are meant to just be for jokes or whether they should be taken seriously. And my next slide is a small quiz for all of us here today. Just in a minute, or let's just say 30 seconds because we do not have time. I want you to just look at the slide, and there are 4 pictures on this slide, and see if you can tell me which one of those pictures you think is true or which one is false, or whether they're all fake or whether they're all real. You don't have to shout out the answer just in your seated position there, or if you've got somebody beside you, you can just chat about it and tell me what you think about these 4 photos. Okay, 2 more seconds. Right, moving on. Let's start with a photo on the right side, the top right. This is a photo of 3 past presidents up there laughing at Donald Trump just because he didn't win the election. So if you look at this picture, it looks so nice, but is it true? Could this be happening? People of such caliber, could they be doing this to Donald Trump? You know, if you don't critically analyze this photo, you will get angry. Why are they treating a president that way? Now let's go to the next photo at the bottom there. This is a very nice photo and it looks so good. It looks so real. That's again Donald Trump, and I don't know why I'm using Donald Trump as an example. That photo is so good, so well created, and you would think, wow, why are they letting the president move out of the White House in just 1 red suitcase and 1 blue suitcase? You know, but that is actually not true. It can't be, but that picture is well created, and that if you don't look at it and look at all the salient points, then you will misjudge that photo and you say, this is how he was treated when he was leaving the White House. Now, the picture in the middle is a picture of a secretariat of the Stingy Men Association of Nigeria. And there might be many people from Nigeria here on this program today. At the beginning of the year, this group came up, they just came up for jokes, for fun. You know, they created a group called Stingy Men's Association. And the next day or so, they had already built a secretariat. How possible is that? But this is someone who has cleverly just got a secretariat of something and put a nice graphic we can see on it. And it just looks so real, like they have got a secretariat. But this is all created for fun. And if you do not know this, you would take it whole-ha, hook, line, and sinker and say, wow, this is a secretariat. And now to the last picture on the left. This is a picture that looks like it is photoshopped, because clearly we can see a dog's face, but we can see the body of a horse. So was a dog's head photoshopped onto the neck of a horse? But actually, among all those 4 pictures, this photo here on the left is the truest. It is the one that is true. This is a Mexican hairless breed of dog. They use this dog as a ritual to escort the dead to the land of the underworld. So they are called, and I cannot pronounce the name, is a Zolo something something. So I call it the Zolo breed of dog. This is a real picture. So I am just using these illustrations just so that you know that there's always more to something. You need to analyze any information you receive. You need to know whether they are actually to be taken seriously or not. And if you ask questions, you're not doing the wrong thing. We have to be careful with the kind of information that we take in, because they can make or they can mar us. Now, moving on to the next slide, vaccine hesitancy. This just simply refers to the delay or total refusal of taking a vaccine, simply put. And this is quite understandable now in the period that we're in this pandemic, because there's so much misinformation out there and people are hesitant, and we should actually take that into cognizance. We shouldn't discard all the information. It's quite acceptable to hear people's views on why they shouldn't be, why they are not taking the vaccine. We should be sensitive to those views. So when people hesitate taking a vaccine, especially COVID-19 vaccine, that is a big challenge against the fight of COVID-19. And vaccinations are considered to be of great public health achievement. We owe a lot to the development of vaccines, because incidences, transmissions, all decrease with vaccine. And looking on to this graph, I call this a graph of success, because it just shows us some illnesses that we had in the past that have now been either controlled or eradicated. And we can see here on the top here, we've got, sorry, I've got to move something off here. We've got diphtheria. First, we can see how diphtheria was in the past, you know, and now it has gone down, it's controlled. This is meningococcus C. We can see the graph. We don't have it, it's not of concern anymore. We can see polio. We can see polio, and you agree with me that Nigeria is one of the countries that has achieved eradication of polio. We got that last year, so that is really good. We can see influenza type B. We still have that, but we're not struggling with it. It's controlled. Measles, the same, it's down, it's controlled. Pertussis, the same, is down. Pertussis is whooping cough. And if we look at this graph, there's more diseases we can add here. At the top here, we can add smallpox, because smallpox is one of the vaccines first created by Edward Jenner in the 1796 or so. And what do we want for COVID today? We want COVID to be found here at the bottom, right here. We want COVID to be a thing of the past. So vaccines have actually contributed to the decline of morbidity and mortality. That's the decline of illnesses and death. Now, there are certain group of people, this is a continuum I'm going to show to you of groups of people and how they and where they fall in the vaccine acceptance continuum. So there's some group of people who you promote a vaccine to. These are the accept all people. You tell them about a vaccine, they will accept it. They don't even want to hear about how good or how bad the vaccine is. They're just ready to take a vaccine because they know it is good for them. And we have here at the extreme right here are the people who refuse all. And these are people that no matter the science behind the makeup of the vaccine, no matter how you promote this vaccine to them, it is a no for them. And this is as a matter of principle, and that's okay. And then you have some people in this category, and these are some people that will accept some of the vaccines and not accept others. And then there's some who will delay. They want to see what is going to happen to this subset of people who are being given the vaccine. They want to see whether it will cause any harm before they put themselves forward to take it. That's fine, but remember that delay also has its own consequences, and there are some people who would refuse some kind of vaccine and would take all. For example, there are some people who have benefited from polio vaccines or maybe TB vaccines, but for these vaccines of today, they would say no. So these are the group of the groups that people fall under when it comes to vaccine hesitancy. And all this is caused because of the misinformation out there regarding vaccines. Now, we know that the infection, this is COVID now, the infection, its presentation, its severity, and the admissions in hospital, and even subsequently death, is more on the BME community. The BAME means Black and minority ethnic communities, or some people call it Black and Asian minority ethnic communities. So that group of people have been disproportionately affected by COVID, and there's evidence is seen in the US, in the UK, and other European countries. And why? The reasons are multifactorial. There are so many, and if we begin to talk about those reasons today, we will not leave here because that is a topic for another day to be explored. But some examples include our living standards, poor living standards, inequality. We constitute a great percentage of frontline workers. We are the most vulnerable. We suffer from comorbidities and so many reasons. You know, I can go on and on and on. But yes, we are the highest. We are the worst hit by COVID. And look at the graph here. And people did not just wake up one morning to want to discriminate against us and say, no, we are the highest hit. They have done their research, they have done studies, and there's lots and lots of information out there to back up their study. And this is one graph that I found, which I think is very good. This is where we fall under, and look at how the graph is. Look at the depth. Look at how long it is to the end. If you turn this graph the other way around, you will see that it is a pyramid like this. So yes, we have been impacted by COVID. We are the worst hit, but we are the least to accept a vaccine. You know, one GP did a study in some GP practices, and the results he found was 20 to 30% of DNAs were people from BAME communities. DNA means did not attend a clinic appointment or did not attend a hospital appointment. So 20 to 30% of BAME communities, of groups, missed their vaccine appointment compared to only 2 to 3% of people from other ethnic groups. That is huge. So what are the reasons? All the reasons we have fall under these three categories. It is one, confidence, trust for policies, trust for decision making, trust on our healthcare services, trust, we have trust and doubts. So that's the first one, confidence. The second one is complacency. We are so complacent. We say, for example, we think, well, we've been told that COVID will only kill like 2% of the 20% of people it affects, because it will only affect maybe 20% of people in the population, and only 2% would die. But that is a significant number. So people just take that as not serious, but actually it is serious, and we must not be complacent of this. And the next is convenience. For some people, truly is not convenient. Maybe it's not affordable, or the hospital or the clinic where they're going to take the vaccine is not readily accessible, is not very near. And this would be for people who are not maybe in the Western world, where health facilities are not, very readily available. But for people who are here in the UK or in the Western world, we really do not have any excuse. And especially for the UK, I know that in every community, there'll be a GP practice where you can walk to for an appointment or to get your vaccine. So convenience will not be the case here. But there are some people who genuinely, and not because of the rumors or anything they've heard, it's just out of lack of, access to receive those services. And then more generally, I'll mention just a few points, and they will all fall under one of these headings. Some people is because of some social reasons, some cultural reasons, some political affiliations to a particular political group that do not want the vaccines. Some people feel it's a social responsibility for them to support their community. For example, a community is saying, we are not going to take it, and you just feel, I can't take it because nobody's taking it in my community. I don't want to betray people. For some people, it's for religious reasons, and most of us, where we come from, we know we're very religious. We take our religious leaders very seriously, and sometimes they do not have the right information. They do not have facts. They do not have figures. They only talk out of emotions because they do not want it, and we run with their own vision. We do not check. We do not analyze. We just take whatever they give to us. And I can tell you that even healthcare workers will fall under this category. Sometimes we know the science, but we are held somewhere because we are so emotional about this particular religious leader that has said this to us, and then we do not do the right thing. And then there are some personal factors as well. For example, past experiences with maybe health services, or maybe family history of someone that has had an adverse effect before in the past. So much social pressure going on. People are saying, don't take it, and everyone is doing it. Everyone is not taking it. Why should I take it? That social norm, we are stuck with it. So these are some of the general reasons, but more specific reasons for us, BME community, is what history has taught us. History has taught us a very bad lesson in the past. There's a lot of inequality and discrimination. BME communities have been taken advantage of. And for example, in the Tuskegee syphilis studies, if you know about the syphilis studies, where a certain group of people were used for a research, and they were not given informed consent, and they were used for this research. And even this was a research on syphilis. And even when a breakthrough came for syphilis, when a drug of choice was found, they were not told and they were not treated. And that is actually unethical, in this day and time. That is actually very wrong. So, and this went on for a very long time. So up till today, people still have that in their mind. So they do not trust these things. They do not trust the authorities. They do not trust the system. And I know that Bill Gates came in the 1990s to apologize, but it still lingers in people's memory. People have not forgotten these things. Some other specific reason is because of lack of research. We know that we do not have good research facilities back in Africa, and then we do not have lots of researchers, even in the Western world, lots of researchers from Black communities doing research. There are very few, but I must commend the ones that are there. They're really doing very, very brilliant jobs. So we've got some very good researchers. Again, lack of trust, people are doubting, people are saying, is it safe to take it? And lack of representation, lack of BME representations in drug trials. That's because we don't put ourselves forward. So we are thinking, well, we are not well represented. How are we sure that this drug will work on us? But the researchers have to work with the resources available to them. If they don't have the Black representation, they cannot stop what they're doing. They have to go ahead with the drug experiments. And for some people, like I said, it's a matter of choice. But if we weigh our options, we have only two options. We have the good option or the bad option. This brings me to the benefits versus the risk. If we weigh our options, we will see that the risk of taking a vaccine actually is very low compared to the benefits. And on my scale here, I have only, let's start with the risk. I have only two things. I have one, the adverse effects of the vaccine, which can be linked or not to the vaccine. So the adverse effect might be linked to or not to the vaccine, because it can be that you have taken a vaccine, but you got a reaction which is not linked to the vaccine. It could just be a mere coincidence that you have eaten something or you have gone somewhere and mixed with something and then you had a reaction. So it should be traced before you can be sure that it is the vaccine that caused it, before you make small videos and post it and send it to 1 million people. You know, we need to check these things. And the other point I have there is the cost. Making vaccines are not cheap. They're very, very expensive. They are time consuming. You know, a lot of resources go into vaccine production. And that is why I don't think people are putting so much money into this just to come and, you know, just at the end of the day, when they know that it won't work, you know, they are putting money and they are going from different stages. If they see that it won't work, they will stop it. And I know Dr. Balogun is going to come and talk about vaccine after this. And on the other side of the scale is the benefits. The benefits outweigh the risk, and there are several benefits I've listed here. The efficacy is very efficient. The vaccines are very good. They reduce severity of the disease. They reduce the frequency of the disease or your frequency of going to the hospital. They decrease incidences and transmission risk, and they help us protect. They help in herd immunity, which Aisha has already explained, because the more people take the vaccine, the more the whole community is protected. And what else does it do? It helps us in reducing our disability adjustable years. These are the years that you spend with a disability, because if you've got an information, it might lead to a disability. But if there's an intervention, for example, a vaccine, it can stop you from, you know, from getting seriously ill. So bringing me to my second to the last slide, just in summary, what I've said so far: vaccine hesitancy is caused by information disorder. And vaccine hesitancy didn't start today, but it has been heightened now because of the change in the scientific atmosphere and because of media environment. Scientific atmosphere in that, for example, this COVID vaccine was made very quickly and people are doubting it. It's because of advance in science and nothing else. And also, my other point is, to be successful in reducing this vaccine preventable diseases, high level of uptake is very important. So there's no point making the vaccine and it's just sitting there and people are not taking them. People have to take them so that we achieve a high coverage. And if there's a high coverage, that means there's better herd immunity. And then also the safety and the surveillance of this drug needs to be understood by the public, because it is not well understood. And that is why people are actually doubting how important and how safe these vaccines are. And then lastly, just 3 points I have here for people to actually take vaccines and for us to counter this vaccine hesitancy. Policies need to be transparent. The process of making vaccines needs to be explained to people, and the public's perspective and views have to be listened to. And with all these, I think we can achieve quite a good level of vaccine uptake. And this is the end of my presentation. Thank you very much.